Euthanasia is understood to mean termination of life by a doctor at the request of a patient. Euthanasia does not mean simply desisting from treatment when further intervention is pointless and allowing nature to take its course. This is accepted medical practice, as is the administration of drugs necessary to relieve pain, even in the knowledge that they will have the side effect of death. The Dutch government does not want to turn a blind eye to the fact that euthanasia happens. The question of whether and how criminal liability for euthanasia should be restricted has been the subject of broad political and public debate for the past 30 years. Euthanasia cases in the Netherlands rose 75% in the past 5 years, from just over 3,000 in 2010 to 5,500 last year. Cases with psychiatric reasons grew from just 2 people, 0.1% of the total in 2010, to 56 people last year, 1% of the total. Dementia cases rose from 25 in 2010, 0.8% of the total, to 109 cases last year, 2% of the total. These numbers are small in a population of 16.8 million, but experts worry how unbearable suffering can be measured in patients with dementia or psychiatric illnesses. One of the most controversial cases in the Netherlands concerned a former victim of child sex abuse that ended her life under Dutch euthanasia laws because she could not live with her mental suffering. The woman in her 20s was given a lethal injection after doctors and psychiatrists decided that her post-traumatic stress disorder and other conditions were incurable. It went ahead despite improvements in the woman's psychological condition after intensive therapy just 2 years earlier. And even though doctors in the Netherlands accept that a demand for death from a psychiatric patient may be no more than a cry for help. In 2015, 56 people with a psychiatric disorder made the decision to use euthanasia to end their life, and the number is only rising. A new study of doctor-assisted death for people with mental disorders raises questions about the practice, finding that in more than half of approved cases, people declined treatment that could have helped, and that many cited loneliness as an important reason for wanting to die. The study, published in the journal JAMA Psychiatry, finds that cases of doctor-assisted death for psychiatric reasons were not all clear-cut, even in the Netherlands, the country with the longest tradition of carefully evaluating such end-of-life choices. People who got assisted to die often sought help from doctors they had not seen before, and many used what the study called a mobile end-of-life clinic, a nurse and a doctor, funded by a local euthanasia advocacy organization. The study, led by Dr. Scott Kim, a psychiatrist and bioethicist at the National Institutes of Health, looked at the records of most of the cases of doctor-assisted death for psychiatric distress from 2011 to mid-2014. In 37 of those 66 cases, people had refused a recommended treatment that could have helped. The study did not evaluate cases of people who had been denied assistance. Depression was the most common diagnosis, but loneliness was also a frequent theme. The patient was an utterly lonely man whose life had been a failure, read one account. And another, a woman in her 70s, said she and her husband had decided years earlier that they would not live without each other. She had no health problems, but after her husband died, she described her life as a living hell. In many cases, the expression of a wish to die by a chronic psychiatric patient can be interpreted as a cry for help. The first priority in responding to such requests is to explore the prospects of an improvement in the patient's quality of life. This does not, however, mean that physician-assisted suicide at the request of a chronic psychiatric patient is prohibited in all cases. In some cases, a voluntary and well-considered request for assisted suicide may be promoted by a persistent wish to die resulting from unbearable suffering with no prospect of improvement, caused by a psychiatric condition. In such cases, assisted suicide may be permissible under the Act, as long as all the other due care criteria has been fulfilled. Around 2/3 of Dutch psychiatrists believe that assisted suicide of a psychiatric patient can be acceptable in certain situations, although not all of them would be willing to actually do so.
A sexual abuse victim in the Netherlands has been allowed to have doctor-assisted suicide because her depression and post-traumatic stress disorder was so severe that doctors in the Netherlands did not believe that she was treatable any longer. Now, the woman was very young. She was in her 20s. The Dutch woman in her 20s was euthanized using a lethal injection after her doctors determined that the post-traumatic symptoms she suffered as a result of childhood sexual abuse were unbearable. Now, she suffered from severe anorexia, chronic depression, hallucinations, compulsions. She did not only go to one doctor. She went to several doctors. They came to the same conclusion, which is why in the Netherlands they allowed her to undergo doctor-assisted suicide.
The reason it's a hard case is because I believe that you can do whatever you want with your body. So I actually believe in liberty, freedom, all the things that libertarians often talk about. And I think a lot of them actually agree with, right? And so if she wants to commit suicide, she could jump in front of a train, she could jump off a cliff, she could do all these different things. And who am I to judge whether her pain is bearable or unbearable and make that decision for her? I should have almost nothing to do with it. So I'm for her freedom to do anything she wants, including this, right? And I don't have any morality attached to it. So if you attach morality to it, it's only because of some old dogma that you got from some mythology. Because in reality, if you look at what real morality is, it's how we treat one another, right? So she's not affecting anyone else. So it's her business, not our business, right? It's not hurting anyone else. I know that her family's, I'm sure, are hurt by it, but that's between them. It's we as the government should have nothing to do with it, right? Now, on the other hand, I refuse to believe that that a mental condition is, quote, incurable, right? So partly not because I'm an optimist. No, it has nothing to do with my beliefs. It has to do with the fact that therapists, first of all, totally have a variance of opinion on this. And oftentimes you have to find the right therapist for you. It might be a good therapist, but not a right match for you. So yes, she might have gone to 2, 3, or however many she did, but it's entirely possible she would have found a therapist that was better for her in some way. She might have found medication that was better for her. And it might be possible that it was not in a year, but in 20 years that she got better. And look, again, I go back to, hey, it's not my business to tell her to bear through terrible pain, emotionally, psychologically, etc., for 20 years on the hope that you might get better. So in the end, yes, I agree that she should be able to do assisted suicide because I think that is an ultimate right that she has that I can't argue with. But I wish she hadn't done it because I feel like that they're in a situation like this, it is not terminal and that there is hope. And remember, she was abused for 10 years from 5 to the age of 15. And another good point here, and a really interesting one, is adults can actually take abuse a little better because they've already developed their mental core, right? But for kids who are young, they've not yet developed it, and that trauma becomes part of their mental core. Or it can in some cases, and in some cases it can be extreme like this. That's why sexual abuse of kids is just even more horrific than you might imagine, and we already imagined it was the worst of the worst. So it sometimes literally ruins their psychology for the rest of their lives.